Hi, I'm Dr. Vivek Bansal, a board-certified and real self-verified plastic surgeon practicing in the San Francisco Bay Area and Beverly Hills. I've been performing liposuction for over 15 years now, and this is how to tell if you're an ideal candidate for liposuction. Today we'll be looking at real women who are interested in liposuction to see if they can achieve realistic and real results. We'll share what you need to know if you're interested in having liposuction. Let's get started.
My name is Rachel. I'm 31 years old and I am interested in getting liposuction. I've got a couple autoimmune diseases. I've got PCOS, which is polycystic ovarian syndrome, and Hashimoto's, which affects my thyroid, and they both affect my hormonal imbalances. So that obviously affects how I carry weight. So unfortunately, no matter how much I diet or exercise, the weight kind of just stays around my stomach. So I would be interested in getting liposuction in kind of my upper abdomen and lower stomach, where kind of hormonal weight just tends to sit and really no matter what I do. So with all that in mind, I wanted to know if I would be a good candidate for liposuction.
Rachel's a good candidate for liposuction because she already eats healthy, she already exercises, she just has that stubborn area in the upper and lower abdomen. So an enhancement with liposuction can really help solve that for her. And then as she continues to eat healthy, continues to be active, there's a chance that she may never need anything in that area again. The average is probably about 3 liters to 4 liters of fat will come out, but we're always surprised. We'll see thin individuals who we may max out at 5 liters, and we'll see larger individuals who have a more liquefied type of fat or kind of looser fat, and they may have about, on average, 3 liters removed. Usually with autoimmune diseases, we do like to get a medical clearance from the physician who's been following their autoimmune disease the most. That could be their endocrinologist or their primary care physician, and I think that's important. We like to make sure their labs are relatively normal, but it is absolutely safe to be able to have liposuction with an autoimmune disease, especially if you can go to a center that does a variety of different type of liposuctions and uses the right technology to make the procedure less invasive for you with faster recovery. For example, in-office body sculpting or in-office liposuction versus going under general anesthesia. In terms of downtime for liposuction, the average patient takes about a week. Although I've seen some people go back in 1 to 2 days, and I've seen patients take longer.
My name is Carmen. I am 46 years old. I'm very interested in having liposuction done. I have a lot of fat and extra skin in my upper abdomen, lower abdomen, upper back, and lower back that I unfortunately haven't been able to get rid of after having 2 kids. So I would like to find out if I am a candidate for liposuction, and maybe even possible for other surgeries because I do have a lot of loose skin.
Carmen is a typical patient we see for liposuction all the time in our office. I think Carmen is realistic about there being multiple options for her. If she wants to fit into a 2-piece bikini, we're probably going to have to go through the tummy tuck or abdominoplasty under general anesthetic. However, let's say she just wants to get a jump start. She wants to get back to the gym, fit better in her clothes, feel and look healthier, then that's where liposuction, as long as she's realistic about the expectations, she can be a good candidate for liposuction. Carmen's body shape, she could get away with doing the front just with liposuction, and then if she does really well with her nutrition, she may not even need to come back for the back. But realistically, she'd probably have to come back for the back at another time. There are many techniques used for liposuction, starting from the traditional liposuction, which I call the jab, jab, jab technique. There's power-assisted liposuction, which uses a mechanical power to break down fat cells. There's laser lipo and ultrasonic liposuction, which can help dislodge fat cells. And there's radiofrequency liposuction, which can help contour skin and tighten skin better. In many individuals, you can expect over a 50 to 70% contraction of their skin, or at least that's what it looks like to the patient. And then if one is not happy with the results afterwards or wants a further enhancement, they can always get a skin removal procedure in the future, which at that point will be less invasive.
Hi everyone, my name is Sarah. I'm 28 years old. I'm getting married in February and I am interested in skinny lipo in my inner thighs. I have these two fat patches that no matter what I do, how much diet, how much exercise, I can't get them to go away. As I'm getting older, they're also getting a little bit worse and a little more saggy. And I've also noticed cellulite on my outer thighs. So at this point, I'm super interested in the skinny lipo procedure. I had a breast augmentation about 9 months ago, and I had a bad allergic reaction to the antibiotics. So I am a little concerned of what the side effects and the healing process would look like. But right now, I just really want to know if I'm a good candidate for skinny lipo.
Skinny lipo has different definitions to different providers and different patients, but it's basic for individuals who already might be at their ideal body weight, like Sarah is. She works out, she eats well, she probably has great genetics, and she just has mildly stubborn areas, and other people may not even think that they're that bad, but she does. In terms of a minimum amount of fat removed, we want to be able to make a difference for the patient, make sure that it gives them the result they're looking for, also to make sure that, they get their money's worth. So on average, we want to be able to at least remove about 1,500 to 2,000 cc's of fat. I think with skinny lipo, you have to be very cautious. For example, traditional liposuction with individuals the size of Sarah can really lead to high levels of lumps, bumps, irregularities, even loose skin. That's why going to a center that offers technology-based options, such as ultrasound, such as radio frequency, might be a better option for Sarah. And we may not have to remove much fat at all. Also, our center has non-invasive body sculpting techniques that may interest Sarah, such as freezing the fat, such as using only a radio frequency externally. So I think it's very important to go to a center that knows or has all those technologies so they're not biased by their decision. Sarah's question about having a bad allergic reaction to an antibiotic, that can happen. The good news is we would not give her that same antibiotic again, and there's other antibiotics which she probably has taken in the past and that won't give her this bad reaction. I think the definition of ideal candidate for liposuction has really changed, similar to using our phones. We used to have landlines, then flip phones, then now smartphones, which can do so much more. I think the definition for the ideal liposuction candidate has also broadened. For us, the most important thing is the patient is willing to do their part and understands this is not just a weight reduction technique. They have to continue to improve their nutrition, improve their activity level if they want to maintain that result. The patient I feel that's not an ideal candidate for liposuction is someone who's only doing this for weight loss, only wants a quick fix and is going to go back to their way of eating and maybe non-activity. Individuals where there's more loose skin can be individuals who are not ideal for liposuction. If you really want the most ideal result for your liposuction, I think it's important to choose a center like ours that not only just does the procedure, has all the technology available, but really emphasizes the post-operative care. We have a very comprehensive nutrition program to help decrease inflammation after the procedure. We really heavily talk about activity levels or the exercise that fits your body type. And we really talk a lot about mindfulness in terms of meditation, yoga, tai chi, to bring oxygenation to those body parts for healing and overall long-term results. We want you to not only look good, but feel good.